I'm Joe Wren. The water crisis in Flint, Michigan has people across the country wondering if their water is safe to drink. It's a question that's especially on the minds of residents in Greentown, north of Indianapolis, where recent tests showed elevated levels of lead in some of the water. That's where reporter Barbara Brosier is. Barbara, just how high are the lead levels?
Joe, the levels are just slightly above the EPA's maximum allowable limit for lead in the water. The superintendent says he has fielded calls from some concerned parents. Most of the people we spoke to, though, they didn't want to go on camera, but told us they don't know enough about the problem to be concerned, or the levels simply aren't high enough for them to be seriously concerned about their safety. Still, the school corporation and the county say they're going to proceed with an abundance of caution. Dozens of containers of bottled water are stacked in the middle of the main office at Eastern Howard High School.
Our children are probably more hydrated than they've ever been.
It's been this way since results came back in January that revealed elevated levels of lead in some of the school corporation's water. The EPA's lead action level is 15 parts per billion or higher. Tests revealed levels at 20 parts per billion in a high school classroom and 22 parts per billion at a kindergarten water fountain.
That raised some concerns, although it's not a Flint, Michigan situation. In Flint, they had levels as high as 13,000 per billion in some cases. But still, it was elevated.
So the school corporation shut off its water fountains and for a couple of days even forbid students from washing their hands in the school sinks. Until levels dip back down below the allowable limit, the corporation is spending $400 a day to provide bottled water for drinking and cooking.
We're going to keep spending the money until we get the all clear from the health department that we can start transitioning back to the Greentown water utility.
The schools teamed up with the county health department last week to offer free lead testing for students and staff. They tested over 600 people.
We do expect some levels to be elevated, but we really think the level elevation will be from the home environment, perhaps from a lead-based paint source, which is really our greatest problem with lead.
But levels of lead aren't just running high in the school's water. The Indiana Department of Environmental Management found elevated levels of lead in November while doing routine testing on some Greentown homes and businesses. The town is already taking steps to correct the issue, asking IDEM for an emergency construction permit to install a polyphosphate injection system. They started using it earlier this month.
What happens with the water when it goes through the pipes, just because of aging of the pipes, it may contain lead, the plumbing components and so on. The lead, just because of normal corrosion, may leak out into the water. When they add phosphate to the water, it helps to stabilize and stop that corrosive process and the leaching of the lead.
The county health department is offering free testing for Greentown water customers who live in homes built before 1986. That's when new laws about lead-based plumbing were enacted. And they've already had about 25 people come in for test kits.
I think it's important for folks to be able to determine what their lead level is for their own comfort.
It could take some time for the town's new polyphosphate injection system to bring lead levels back down. Even so, the health department says Greentown water is safe to drink. The local school corporation just isn't taking any chances.
We're right now in the process of putting filtration systems on all of those drinking fountains, and that's going to take a couple of weeks. And then once those filtration systems are in place, we'll retest the water and see where we're at and determine if then we can allow kids to drink from drinking fountains.
It could take up to 4 weeks before those lead tests come back. After that happens, the county says they'll work with the school district and the local utility company to determine how to move forward. Reporting in Greentown, I'm Barbara Brosier for Indiana News Desk.
Thanks, Barbara. We're joined now by Jim Barnes. Barnes is a professor with IU School of Public and Environmental Affairs and the Maurer School of Law. He was also there for the formation of the EPA and has the EPA's general counsel. Thanks for being here.
Nice to be with you.
Today, you know, we just heard in that story about the superintendent of the Howard County School Corporation say that the lead levels there are not close to what was found in Flint, Michigan, but they did exceed levels. Can you put in perspective the two different situations?
Well, sure. To begin with, the EPA's goal for lead in drinking water is zero. Any level of lead in drinking water is something we want to avoid. And EPA does have what's called an action level, where we suggest people test the schools and drinking water in schools and homes. When it exceeds that, then they need to take steps to try to figure out how's that lead getting into the drinking water, usually because it's leaching out of plumbing fixtures. But as you mentioned, it's a long ways away from Flint, but still I would really commend the superintendent for taking steps here, because we're most concerned about lead exposure to young children whose brains and so on are still developing, and that's not the point when you want to have them exposed to excessive levels of lead.
I wanted to bring up the House Bill 1082. Can you tell us a little bit about what that bill does, and if it was enacted earlier, could that have prevented what's happening in Howard?
Well, in its original form, it would have prohibited the state regulators from enacting any regulations that were more strict than EPA has. And as an example, it would fit this. During the time I was deputy administrator at EPA, we made a decision to extend the drinking water standards to schools and factories that drew their water from wells, as opposed to getting it from a public water supply, municipal supplier. If we were still in that state of affairs, and this issue came up with this school system, and they were drawing their water from wells, the state of Indiana could not tell the item could not tell the school system that they needed to do something about the lead levels in the drinking water in the school. Now, my understanding is that the state is in the process of amending that, and that it may be less onerous, but it's a provision that's in place in a number of other states, and hard for me to understand why a state would not want to be protective of its citizens.
Thank you very much for being here today.